I'd like to call the Health, Human, and Social Services Committee to order. And the first thing we need to do is approve the minutes of last month's meeting. So if someone would like to make that motion, Supervisor Driscoll, seconded by Supervisor Loeb. Any additions or corrections? All right, all those in favor?
Aye.
Opposed? Carried. And with that, we will turn it over to Carrie, who's filling in for Rob today.
Good morning.
Nice to have you here. Thank you.
I'm Carrie Wright. I work with Rob York at the Office of Community Services, so you're not as accustomed to seeing me. I've been to a few. But I think we just wanted to give you some updates on some of the things our office has been working on. The first one is a Bureau of Justice Assistance, a federal grant that I came across, and it was really a fire drill to try to pull people together to apply for this. Really short time span. I think we had about 2 weeks, so our chances probably aren't great, but it's a $600,000 grant for 24 months to help. It's called Data-Driven Partnerships. It was in your attachments. I have paper copies if anyone wants them. You're welcome to them. But it was really to identify community resources to pull in data since we're all very siloed. We got a whole host of letters of support. Thank you to everyone, to DSS for doing that, from both counties, both sheriff's departments. There was no federal match for this, which was really good, so it was just straight funding. We didn't have to, the county didn't have to do any matches for that. So we just wanted to make you aware in case we happen to get this. I think we find out at the end of August if we did. And there's 6 grants nationwide, so it's really super competitive. But it was a great learning experience for our office to get involved and to really pull in and our community partners and collaborate on this. So we're hopeful that this is a possibility. We also would receive priority consideration for this grant because our AHI, which is our PPS, if you're all familiar with PPS, they received a rural planning grant for opioid planning responses. So because they received that, our community would have received priority consideration for this. So that was part of the reason in applying it, that we had some really positive things already occurring in our community that gave us a leg up on this. So we figured we'd throw our hat in. So that is the first one. The second one on the agenda is the jail-based SUD, the substance use disorder treatments and options that are going to be available in the Warren County Jail now. We've contracted with ACCA, which is Addiction Care Center of Albany, and they will be providing some groups, counseling, and eventually look at, I think, folding in some of the Medicaid-assisted treatments for inmates in the Warren County Jail. That was state funding, $60,000. Not a whole lot, but we're hopeful that that will be ongoing every year. So that's really good. The jail is currently working with ACCA to develop those services, and I believe that they've actually hired someone. Also next on the agenda is to talk about our ABLE programs. ABLE was a program we helped develop, our office with Baywood and WWAMH, which is the Warren Washington Association for Mental Health. Again, there was a fact sheet included in your information, but ABLE was funded through DSRIP, through Innovation Funds, through AHI. It's a year-long funding, so the funding will be used up at the end of this, at the end of December. So we're really trying to find ways to sustain this program. It's a reentry coordinator, so it's one person currently who is housed at Baywood that is working with both Warren and Washington County Jail inmates to help them as they're leaving the jail get hooked up with, we now have EASE, which is insurance navigators coming into Warren County Jail, to help them get hooked up with health insurance, because that transition has been difficult, even though it's supposed to be smoother as they're leaving, to make sure that they're insured so that they can follow up with treatments, either mental health or substance use treatments. There's a lot of research that shows people are at highest risk as they're leaving jail for overdose. Obviously, if they go back out into the community and use opioids, if they were addicted that they were using before they went in, it'll be a fatal level. And so this reentry coordinator, lots of evidence-based practices and research that shows having a reentry person do warm handoffs, provide wraparound services, and get people hooked up in the community is a really, it's a cost savings, and it's just absolutely necessary. necessary to help these folks remain successful. So just to highlight, if you don't mind, there was a few cases that Abel, the coordinator, Amanda Zeno, is the one actually providing the services, but she just gave me like 3 highlights of cases of one woman who was referred to Abel by her probation officer. She completed temporary assistance prior to her release from jail, was placed in a hotel. She's now residing in independent housing and working 30 hours a week. 3 months after Abel checked back in with her, she remains employed, is living in the same apartment, and is paying restitution. So this is really helping, again, people remain connected, not lose touch with their probation officer. Another case was one gentleman that was a sex offender. He had been incarcerated for 10 years. He got long-term health home case management, which helped him, got some assistance from DSS, is currently working with parole, and is still free in the community and is doing really well. So that's amazing. And 10 years of being incarcerated is costly, for him and for society in general. So, and the last one I just wanted to point out was a gentleman that is now, he had gotten referred through ABLE to River Street Men's Community Residence, graduated from there, is living at home, I believe, with family, continues to remain in treatment, is attending treatment, and is complying with drug treatment court. So just a couple success stories to highlight how Amanda has been able to really help these folks get hooked up with the services that they need. And I think last on the agenda, Uplift. That is not our program, but we've been involved just in getting out the information about it. Uplift, again, is funded another year, I think, innovation grants through DSRIP, through the PPS, AHI, and that is transportation services, which I'm sure you're all aware is a desperate need in a rural community, especially for folks that have any kind of mental health or substance use issues. And so Uplift is available to individuals that have visited the emergency room or have been in the hospital and discharged within the last 30 days. And so they've been able to, help people do laundries, a lot of different innovative approaches that, if those things hadn't happened, it could have led to a very slippery slope of a person ending back up in the hospital for mental health, substance use. So there's a lot of social determinants of health. I'm sure you've all heard that and the highlights on that in studies lately that are really keeping people safe, keeping the public safe, and saving money by investing upfront in these services. So we're really excited to see Uplift in the community. Cassandra Fleury is the program coordinator for that. She is also housed through Baywood, so Baywood has done a phenomenal job in our community to really take on some of this additional funding and these programs, which are short-lived. The issue is always sustainability, but to make sure that our community has the services that we really need. So Baywood has just done a really phenomenal job of that. And lastly, AHI also applied. There was another Bureau of Justice Assistance, the same federal office that we applied for grant funding, that came out shortly after the one we applied for. It's called Rural Responses to the Opioid Epidemic Grant. They will also receive priority consideration for this, very similar to the data-driven partnerships one we applied for. This is $750,000 over 2 years. We had considered doing it, but when we collaborated with AHI, since they already were, we let them take the wheel. They have a consultant that they hire to write the grants. Our office really just pulled in 5 or 6 people to help do this fire drill. So they will probably have a better chance. So that could be coming down the pike as well for our community. So that's really encouraging. And I
Very
think
good.
that's
We
it.
appreciate that update, but
Yeah.
I saw your hand go up, Mr. Leggett.
Yeah, thank you. Jerry, on the AHI grant that's going to expire here at the end of...
For ABLE, the reentry.
Yes, for the
coordinator.
ABLE,
Mhm.
yeah. But you're deriving data from what's going on now, because the whole intent is to decrease recidivism.
Yes, recidivism, and to make sure that people remain in treatment. That's always, they have the gift of desperation while they're in the jail, while Amanda goes in. So people are more willing to accept services. It's really taken off.
So you think you'll have some data for that evidence
I think
base?
so. That's what we're working. We're
Okay.
meeting with the Sheriff's Department again. Sometimes that's part of the data-driven partnership issue is that we all have data in silos, and trying to get that data into one kind of warehouse or even one Excel spreadsheet has been really difficult. Right now, it's basically Able is checking to see if people have been rearrested. You know, they're looking up the public information because there's so many different places people could have been arrested here locally. So we're doing that, but really the data they're collecting is more what they've been hooked up with from their end. It's not as much on the law enforcement end, so that we really need to get a better handle on.
But if I may do a follow-up, bail reform is coming, so not as
Right.
many people are going to be
Are going to be in the jail.
incarcerated. So how does that affect your stream? Obviously, it's still going to be people that have need for it.
Right, and so we're also looking at some diversion options. I'm always looking for funding opportunities. We really have no diversion programs in Warren County. We have a criminal justice and community services task force that's been organized really only in the past 10 months or so. Big group, it's really growing, lots of folks, but we don't have good subcommittees yet to kind of execute actual goals, but we've had LEAD come in. I don't know if you're familiar with LEAD. LEAD is a diversion program that they do in Albany. It's been very effective only in the city of Albany, so Glens Falls PD has shown some interest in that. But the hope would be that that would grow to the county and to the sheriff's department. So we've had conversations with them, but it's a long process. So diversion is sort of next in line, which would help with the bail reform, because obviously the jails are not going to have the census numbers that they've had once that happens in January. So there's a lot of moving parts, as there always are, that make it interesting.
Thank you, and thank you
Yeah.
for considering all of that.
Yeah, we're aware. It's hard to...
Supervisor Loeb?
Thank you, Madam Chair. I have two questions. One, do we have any resolutions that we need to
No.
pass with this? Oh, all right, thank you. The other question is, I've been asking various people and still haven't gotten a satisfactory answer, so I'm thinking you'll be able to help.
All right.
AHI, we have a whole population in our community, and then we have a lot of employees that work for AHI. What do they actually do?
They-
It's never been clear.
They're a performing provider system. It's called a PPS. So it's an entity. They got the funds flow through DOH, if I understand correctly, Department of Health, for the Medicaid redesign. So all that district money that was coming into our communities was flowing through them. Correct, right? If you have any views or understand better, let me know. So they're really the mechanism for that. Part of the issue or concern is that district has ended, or is it? It's ended. Yeah. So they're looking at, I think, Department of Health, there may be more funding coming in. Nobody quite knows. It's all very sort of nebulous and gray right now. But they are finding ways themselves to keep, going as an organization. I don't think they've had to let anyone go. So although the funding is coming through them, flows through them to the community.
So they were essentially a distribution administrator of the money.
But they also do care, they do the health home care management. They have a lot of different programs that they provide. So they still provide health home care management, which is still going on. AMH is a health home care management.
Hands-on with them.
Yes, so
Clients?
they do, well, they send them downstream to AMH. I don't believe that they provide health home care management to individuals, but they may send them to the downstream providers. They're much more administrative in nature, absolutely.
Thank you.
Yeah.
Thank you.
All right, any other questions? All right, thank you very much for
Yeah,
coming. You
thank
did a
you.
good job filling in for Rob. We
Thank you.
appreciate that. Have a nice day now.
You as well, take care. Stay
Thank you.
cool in the heat.
Okay.
I'm looking at the agenda ahead.
Okay.
What? Where'd they all come from?
You don't mind the informality, and as long as I can be heard on the mic, I'll sort of introduce the first item while I'm passing out the agenda.
That's fine.
A couple of years ago, we were asked to execute a memorandum of understanding. Under the Workforce Investment and Opportunity Act, there's federal legislation requires that 14 partner agencies enter into these agreements, and it was all coordinated through the New York State Department of Labor. they obtained authorizations at the commissioner level and had the language all approved for everybody to sign off before it went to the local communities for their acceptance and execution. And there's a second part to that, which is what we're talking about today. The first part just says, basically, we'll all work together, we'll all share resources and referrals. A lot of the required agencies, we don't have those programs in our region because they just don't exist. One would be, there's actually an employment program through HUD that doesn't exist in our 3 counties. There's a senior service community block grant that we don't receive here. It's administered on a statewide level. So a lot of those partners don't exist in our 3 counties. The next piece is what we're here for today. And at first I thought it was just a new signature on the old agreement, and that's how I had forwarded it to the county attorney's office. It was then made clear to us that it's actually a new agreement. And what they call the infrastructure costs are the costs associated with running the Career Center. And right now, there's just ourselves and the Department of Labor that pay for that. They actually have our draft budget as part of the agreement, how the Career Center is being funded. Since the resolution request went out, we were told that there was going to be a change in the actual document itself. One of the signatories is going to change. And so we were asked to hold off on the actual execution, but I didn't see any reason to withhold it from the committee since it was already on the agenda. And typically the resolution reads, subject to review and approval of the county attorney. So the actual agreement was forwarded to the county attorney. Apparently that's going to change, but I don't see any reason to not move forward with it this morning unless there's concerns or comments from members of the supervisors.
Okay, so would someone like to make the motion to approve that? Supervisor Loeb, second by Supervisor Sokol. Any questions? Ms. Bramer.
Thanks, Chairwoman. In the description here, it says the MOU does not create any contractual rights or obligations between the parties. Wow, I can't speak.
Yeah.
But just documents existing agreements and is still accurate?
Yeah, and that's actually right out of the memorandum itself. That language was pulled right out of the memorandum.
Any other questions? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
The next 2 items are both related. We have 2 openings on the Workforce Development Board currently. One was, a term was off and the person did not wish to be reappointed. And then the other one was someone changing jobs, and so we have a new appointment there. Typically when we look at new members, we try to be strategic in terms of the industry that they represent. And in today's appointments requests are very deliberate about that. The first one is Michael Irish. He's the Human Resource Manager at Fort William Henry. We've always felt that it was important to have somebody from hospitality on the Workforce Development Board to represent that industry. Mike has been on the board in the past. He stepped off the board about 3 years ago when we reorganized under the Workforce Innovation Opportunity Act, and he was interested in coming back.
All right, someone like to make that motion to approve?
Without objection, I'd like to move that we do the 2
okay.
together.
That's fine, okay, that's fine. And the second person, no, Chris, you might just want to tell us who that is?
Kathy LaFond is the Human Resource Manager at Glens Falls Hospital, and her supervisor took a new job and left the hospital, and she actually suggested that we consider Kathy. In addition to being HR person at Glens Falls Hospital, she's president of the Adirondack Human Resource Association right now. So we thought that she would be a very good person to represent not just the health industry, but also the human resource is a profession.
Right. All right, we made the motion by Mr. Driscoll, a second to that motion. Supervisor Bramer, any discussion?
Oh, just one question, Mr. Chairwoman. Here, past the names in parentheses, CA 11, 2017, CA 06, 20, what's CA?
Those are the old certificates of appointment.
Thank you.
Yeah, certificate of appointment. Yeah, good question.
All right. Any other questions? All those in favor?
Aye.
Opposed? Carried. Thank you.
The only other thing I have is the youth picnic coming up in August, and I will get a invitation out to all the board members. It's the same Friday as the board meeting, 16th.
16th. Mhm.
We moved the start time back. So hopefully you'll be able to come to the board meeting
And then come
still
down.
get down to the picnic without having to either rush or leave early.
Sounds good. Committee, have any questions? All right, I guess we're good. Thank you, Chris.
You're welcome.
She's been in.
Some of them. How's the campaign going? Oh, you're not running. You aren't either. You run again. Too many other things going on.
All right, should we go ahead and... Chris and Julie, we're going to move right on to you. We're not quite sure what's happening, so we'll... No, that's all right. I wondered when I didn't see her.
I'm part of that.
Thank you.
This is my kid.
Okay, thank you. I'm going to hand a couple down for you.
Okay, thank you. Which is personnel.
Thank you.
Thank you, sir. Mr. Chevron, Railroad Road, all fixed up. German there, we're washed out. Yeah, one. Yeah, good. Thank you.
Oh, it's been open a while now. I can't even remember when.
Trying to remember. Came up to the end.
Yeah. It's been long. Yeah. It's old news. We're so glad
On to the new.
it got fixed for not all that much money. Okay, everybody ready? Not what they told us in the beginning, 3 million. Look,
Morning, everyone.
Morning.
Good morning.
We just have some request resolutions for personnel that we're going to present today. The first one is notice of intent to fill a vacant position of senior caseworker number 4 in the Child Protective Services Unit. This is due to a promotion effective July 8th.
All right, someone like to make the motion? Supervisor Loeb, seconded by Supervisor McDevitt. Any questions? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
The second one we have is a notice of intent to fill the vacant position of senior caseworker number 3 in the preventive unit. This is due to a lateral transfer effective August 5th.
All right, someone like to make that motion? Supervisor Loeb, seconded by Supervisor McDevitt. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
The third one is a notice of intent to fill the vacant position of social services attorney. This was due to a resignation effective July 22nd.
Okay, someone like to make that motion? Supervisor Sokol, seconded by Supervisor Loeb. Any discussion? Supervisor Leggett.
Thank you. Can you fill us in? Was that a recently filled position?
Yes, it was.
Okay.
It was an attorney that we had hired back, who had previously worked at DSS. He came back for a few months and just decided that it wasn't his cup of tea, so he did leave us. Unfortunately, Phil did a really good job for us when he was there, but we no longer have him, so we'll be looking for a new attorney.
Okay, Supervisor Driscoll.
Thank you, Chairman. Last year, when we we modified the job description. We took one of the responsibilities, I think, of assistant commissioner off the table. Do you see a need to possibly modify this job description in order to better ensure maybe longevity with the next person coming aboard? Or, I mean, how confident are you that you might fill this in a timely manner, an efficient manner?
I don't necessarily think that we have to modify the current position. I think when we did that redesign last year, that I worked with a lot of different people on that to make sure that the position was going to be, what it needed to be. We had several applicants the last time, so I'm hoping that we will have some interest in this position, within the next couple of months, hopefully get it filled.
Great.
We do have an interim plan in effect, so we'll get through it one way or another, but thank you for that question.
Thanks.
Did I see someone else's hand? Supervisor Leggett.
What is that plan? So you're shorthanded, are there 2 attorneys now?
We have 1 attorney now and legal secretary. When Phil had come to me and put in his resignation, met to formulate a plan on how all the existing cases and work was going to get done in the interim. Hopefully, it won't last that long. We also had an offer as backup for help from the county attorney, Mary Cassane, and the county executive, Ryan Moore, are aware of the situation. We're going to try not to burden them with anything, but for the time being, we're covered. Hopefully, we'll get someone in there and not have to bother the county's attorney's office with some of this work. But, thank you, by the way, county attorney's office. Ryan?
Well, so that comes back then onto wage schedule and whatnot, because we reorganized for public defenders and district attorneys on attorney wages, and we're working with social services too, weren't we, on trying to get parity among, does that fit, this wage fit into that whole new schedule?
Yes, it does. Yeah. When Phil left, he did not discuss with me, at least, that it was a wage issue. Okay, so that was not one of his concerns. But yes, the current wage is in the new structured attorney wage for the county.
Any other discussion? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
Yeah, you covered it all.
The next one we have is to fill a vacant position of caseworker. This is to be determined. This would be a grade 16, and the effective date would be determined. The reason why it's to be determined is this person, this vacancy will be because of a promotion to that open senior caseworker number 3 in the preventive unit above.
Oh, okay.
So it's a kind of a backfill. We anticipate a promotion coming up.
All right, thank you. Someone like to make that motion? Supervisor Loeb, seconded by Supervisor McDevitt. Any further discussion? All right, all those in favor?
Aye.
Opposed? Carried.
The last intent to fill is for a vacant position of social welfare examiner in the Medicaid unit. This is a grade 8. This is due to a lateral transfer effective July 10th.
All right, someone like to bring that motion to the floor? Supervisor Driscoll, seconded by Supervisor Loeb. Any discussion? All those in favor?
Aye.
Opposed?
Carried. Thank you.
Thank you. And that's all I have. An activities and update report is attached to my agenda.
All right.
Good budget through June. 6 months into the year, we are coming in under the 50% expenditure lead-wise for revenue. So we're in pretty good shape. Our overtime, the CPS calls are still coming in, and quite a bit of overtime associated with CPS, our budget. be okay with that there as well.
Anyone with questions? Supervisor Loeb?
Thank you, Madam Chair. The revenues and expenses flow routinely. Sometimes they come ahead, sometimes they're behind. Usually they're behind. A lot of numbers there. Do you see any red flags, even small ones, that you say, oh, maybe you talked about it earlier today or yesterday, and it slipped your mind, but like, something's not right here.
Well, I'm always concerned that, things will happen and the revenue won't be what I anticipated, but for right now, the first half of the year is always slower for whatever reason, I think because the state fiscal year ends in April. So until then, they're not sending us as much money. Typically, the second half of the year, we see more revenue coming in. And you kind of see that for June, our revenue was way higher than May was. So I think we're starting to see the upswing there. Our claiming is every month, and generally there's a 3-month lag from claim to revenue. So what I'm seeing in claiming will, when the revenue comes in, I'm anticipating
One more question, Madam Chair. In the past, we've had times where the HEAP program has been short-funded. How are we situated for this coming winter?
Well, we haven't received the HEAP allocation yet for 2020. Our early outreach is going to be starting, so I'm anticipating getting the allocation. However, we never have enough HEAP allocation to run the program. And that's statewide. That's not specific to Warren County. What happens when HEAP allocation runs out, then it's charged to food stamps because they do. If you qualify for food stamps, you automatically qualify for HEAP. So the revenue, we get 50% reimbursement through food stamps. So at least there is some kind of revenue coming in when we reach our allocation or spending over.
Thank you. Thank you, Madam Chair.
Any other questions? Nothing else on the agenda for us, Chris or Julie? Another question?
Well, not for Julie, but for Chris, I
All right, go
have
ahead.
a question. As I had copied you, Madam Chair.
Yes, you did.
Chris, regarding the proposed new rules coming out of Washington with regard to food stamps, I'm looking over the, you sent me the proposed rules, and in life we know about the glass being half full, the glass being half empty. There are a lot of ways to looking at things. Here's a proposal where their justification is this is going to make it neater. We're really fine tuning it, and it sounds like that's a really nice thing. We're all eager to make sure we have a nice tight ship. But if I can use an analogy of we have an escape rescue craft, and you need to have qualifications, meet our qualifications to get on board, and you let everybody on board. But there are other people that are saying, I might not need that, but I need to get out of here. So they grab a hold. That's not a nice package, so they start brushing everybody off. And that's what we're doing here. We're brushing people off because it's not a nice, neat package. I'll give another analogy. The people up on the upper decks are asking the less fortunate people to work harder at pumping that water out because our wine cellar might get a little damp. I'm concerned about this. Their justification is to make it neater, and all right, we're going to lose several million people, but after all, they are poor people, and they need to work harder. I'm wondering, from the report and supporting data, there was indication that it hasn't been really sorted out as to how this will affect Warren County or New York State. What's your thought? And my further thought is, since it's probably going to affect people in our communities, that we should send a letter to Congresswoman Stefanik asking her for support to work to try to prevent this loss of services to our community.
I think right now we're kind of in a holding pattern on this because we don't really know how it's going to affect local, and we also don't know, which pieces of these will actually come to fruition. But in regards to writing letters, we've been on a letter writing campaign lately for a lot of different legislation that's coming out at the state level and federal level. I personally have written several letters against proposed legislation, some of which is on the governor's desk right now. This particular situation, I think really, it's pretty obvious that it's politically driven out of Washington. It sounds good, and like you said, it looks good in a lot of ways, but, as far as how it's going to affect local, we don't really know yet, but I can say that we are a little bit concerned because there is a possibility that there are some people that might not qualify anymore, and I think that, from a philosophical standpoint, people need food, they need nutrition. The more fortunate people, really, the money, where's it going to go anyway? We already waste so much food in this country. It's unbelievable. If people have less access to food, there will be more wasted food, there will be less nutrition, there will be more of a negative effect on children and vulnerable people as well. And there's only so much that places like community action can help in communities. So I think we're definitely watching this and a bunch of other legislation as far as specifics of how it's going to affect our community. I don't think we're at a point where we can really say exactly what's going to happen, but we are concerned because there is a possibility that, as you know, this looks all very nice and it looks neatly packaged. But as we know, there's a lot of legislation that comes out that is maybe starts as a goodwill gesture or a good idea that really isn't thought out that well, is half-baked, and really doesn't really do what it was intended to do other than cost more money and help less people. So, as far as specifics, I can't really answer the specifics at this point as far as the SNAP changes. One of the other things that is concerning is that they're trying to change the poverty level, the income level, so that's a concern as well. But thank you for your concern. I've heard from a couple of supervisors here in regards to these things. And if you do see something specific that you would like me to write a letter, either in support of or against, as long as I can do that, I will be certain to do that, so let me know.
Okay.
Madam Chair,
Yes, Mr.
since
Lowe.
we're not meeting every day,
Right.
there is a public comment period that is still open into the fall. I would be interested, and I don't know if it requires a motion, but I'd be interested in a letter coming from this committee asking Congresswoman Stefanik to fight for our community in this regard, to take care of that small group of people. It may only be a handful, it may be 10 or 20, but those particular people, those families are going to be hurt if any of this comes.
Is that the feeling of the whole committee, that you would like to have this letter written?
Yeah, I would support that, yeah.
Mr. Driscoll? Everyone, do we need a motion for that, to write a letter?
Yes, if it comes from the board, you do.
Yes, we do. So we need a motion. So
I
Mr.
would like to make
Lowe,
that
we will
motion.
make that motion, and second to that motion, Mr. Driscoll, you want to do that?
Yes, yeah, thank you.
All right, all those in favor?
Aye.
Sorry, Mr. Leggett.
I just wanted some more clarification. It wasn't detailed of what the changes were and who exactly is going to be affected, and wanted to hear.
There was, thank you. There was a short little article in yesterday's Post-Star that kind of talked a little bit about that, and certainly it's a matter of concern. Historically, when the government tries to make changes like that, a year ago they made a change. They decreased the benefit level, the minimum from $16 to $15, the maximum from $195 to $192. So there was a trade-off. They decreased the amount that an individual or household could receive, but they increased the amount that total income, total gross income that a family could receive. So it was kind of a balancing act. More people could be eligible for SNAP benefits, but those that do receive them were going to get just a little bit less. So my thinking is that when they go before Congress and all the different committees and start talking this out, that there'll be some compromise, and the worst case scenario will probably be kind of, middle of the road, if in fact it even goes through. But certainly I would encourage not just the committee, but individual townships, and I think you can get from Chris statistics as far as the number of individuals that from each community or each zip code that the county is servicing, not just with SNAP benefits, but HEAP, Medicaid, all of those different programs. So I would encourage you to keep in touch with the commissioner and do your own due diligence as far as reaching out individually to the Stefanik's office, and just keep on educating yourself about what's happening.
All right, one last comment, Mr. Loeb.
Just to explain specifically what we have here, there are specific requirements for eligibility for food stamps. And once that eligibility level is met, there are other kind of loopholes. They're calling them loopholes. They're loopholes. That's fine. But there are a couple other additional avenues that people that wouldn't necessarily meet the strict guidelines for food stamps, by using these ZIP-in avenues, they're able to access this benefit. And those loopholes, by nature of, we got to close the loopholes, but that's what they're trying to do, close those loopholes. But what they're doing is they're blocking those people who want to get the food stamps, for the reasons Chris mentioned, from getting them. And that's,
Okay.
in a nutshell.
Just one quick, one of those loopholes, as an example, is a victim of domestic violence, an individual who could have been displaced, could have been a middle-income household, but certainly isn't now. So they're going through, legal system, court system, and all that type of stuff. But ensuring that individual, her and his family, are taken care of, during the crisis is important. That's one of the so-called loopholes that exist for many states, not all states, but many states, and I believe New York State is included in with.
That would be closed.
That would be closed, yeah.
All right, we have a motion on the floor, second to the motion. All those in favor?
Aye.
Opposed? Carried. Anything else? We are running a little bit, I do have one other department, so kind of need to get moving, so.
Just quickly, Madam Chair, I would like to follow up on this to let everyone know that the New York Public Welfare Association's legal unit keeps a very close eye on any legislation coming out at the state or federal level, and if it rises to the point where they feel we should be writing letters, they let us know, and sometimes they give us wording that will be helpful. So if I get any further information on this, I will forward it to you all here, and I will also join in on the letter writing campaign. So we have people in Albany who are monitoring all these situations constantly, and this is one of the probably most intense legislative cycles I've seen in a long, long time, because there's so much legislation out there, and unfortunately with the amount of legislation that's going to affect social services, this SNAP thing is kind of down, not at the bottom, but it's in the middle somewhere, because there's some other stuff that's really scary out there. So we have been writing some letters, as I said, and I will let everyone know here if we get a green light from the New York Public Welfare Association legal unit that says we need to start writing some letters on this one.
Great, we appreciate that.
Thank you for your
Thank you, Chris.
concern.
And thank you, Julie.
Thank you.
Have a good weekend.
Yeah, you too.
Hey, Chris.
Put in the whereas. No. The effective population.
Oh, well.
This is.
That's a report. I was a good girl, I read it.
You read it?
I did read it, ask my secretary. I was, first of all, when you have a $10 million budget like that, well, no, I ran the whole thing right off.
Actually, it's on mine, but yeah. You know, when you're writing grants and things like in there.
And that happened immediately.
Thank you.
Yeah.
He is here today. Okay. I'll pre-warn him.
But I'm sure that their trade association down in Albany has the templates
I'm glad that worked out.
to, good letter writing.
Are they fixing
What I
it?
always do with those is kind of localize it, give it a...
Thank you.
This is good. Ryan will put the letter together.
Yeah.
But, you know, coming from our board
Oh, sure.
versus Albany.
Yeah, oh yeah, no, I agree, no, it should be local.
Personal.
But yeah, they can give us a template with all the specifics and we just
Keep track of.
make it a local letter, yeah.
Vermontez,
Okay, we're all set to now.
the highest rates.
Morning, everybody. Morning.
Morning.
So our first request for resolution is to reject all bids from WC 4819 with regard to transportation for eligible children in early intervention and preschool programs. That's attachment number 7. One proposal was received which wasn't responsive to our bid or acceptable, and that was withdrawn prior to the last board meeting.
Move it.
Supervisor Leggett, seconded by Supervisor Loeb. All those in favor? Opposed? Carried.
So we're going to try again. So the next request for resolution is to award bid WC 5319 and authorize agreement with the lowest responsible bidder to provide transportation services to eligible children in early intervention and committee on preschool special education programs in Warren County. That's attachment number 8. The rationale is that we have to have a provision for transportation, which is a requirement of the early intervention and committee on preschool special education programs. A viable contract is needed to be in place by September 1st to ensure that these services are available. The bid proposal is actually in process, and the lowest responsible bidder and rates will actually be known later today.
All right.
But you'll certainly have that information before your August board meeting.
All right, thank you. Motion by Supervisor Sokol, seconded by Supervisor Kramer. All those in favor?
Aye.
Opposed? Carried, thank you.
Next is to authorize a contract with Amy Catalfamo, sorry, ABA Sensory Tot Spot Occupational Therapy to provide committee on preschool education services to Warren County children that are eligible. That's attachment number 9. This contract will increase the availability of services for children in need. Services are provided at a rate set by the state, and they're going to be reimbursed at 59.5%.
All right, someone like to make that motion. Supervisor Sokol, seconded by Supervisor McDevitt. Any discussion? All right, all those in favor? Opposed? Carried.
Next is to request resolution to amend Resolution 271 of 2019 and contract with Field Goods to increase the amount from $4,300 not to exceed $5,000, which is on attachment 10. There was a calculation error in the previous request, and the new amount reflects a $50 error, but also provides us the ability to utilize additional funding if available.
All right, someone like to make that motion. Supervisor Leggett, seconded by Supervisor Loeb. Any discussion? Supervisor Leggett.
How's this program going?
Very good. Actually, Janelle's the one that orders the food, so.
Yeah, it's actually been going great. We have had a lot of interest in the program, and some We actually had a little bit of a hiccup where we weren't thinking about it first, where WIC participants get their benefits every 3 months. So a family who's next up on our waiting list actually may not be receiving a benefit appointment, but we've been very pleasantly surprised that they've actually been wanting to come pick up their food bag still, despite the fact that they're not receiving their benefits right at that moment. And they're saying that they're using all the food in it. They're really surprised at how much food we've been giving, and it's great now with the summer months. We've been able to do some fresh blueberries from the area, squashes, tomatoes, and we always throw in something a little different. So we've been throwing in some rhubarb, beets, different colors. It's been really good.
We also provide a recipe to
Yeah,
use the
to use the
ingredients so that they
ingredients.
know what to do with them.
And how to handle them, how to maybe introduce them a little bit more to their kids, stuff like that.
Good idea. All right, motion is second to that. All those in favor?
Aye.
Opposed? Carried. Thank you.
Next is to request resolution to accept our 2018 annual report, which was in your agenda packets as an attachment. We do have a few here, if you would like one in the hard copy. So please grab that after the meeting if you're interested. But annually, the report is prepared and used for a variety of purposes. And once it's approved at the board meeting, which hopefully it will be, we post it on our website because a lot of different agencies use that information to prepare for grants.
All right, would someone like to make that motion to accept that? Supervisor Driscoll, seconded by Supervisor Loeb. Any discussion? Supervisor Leggett.
Mr. Chairman, how long does it take to prepare this report?
Ask Janelle.
I guess you could say till July. The fiscal information usually lags because of when the books are closed and being able to prepare the reports with the fiscal information, also insurance lags. So most of our data from our programs was available earlier, but we had to hold it to wait on the fiscal.
It's pretty extensive, and
Right.
it's just thinking, and you do that all in-house, pulling all that.
And there's a lot of information in there. Really, it was amazing. I have one question, it may be off track, but you know, you provide these services to like 3-year-olds and younger, but how do the names of those individuals get to you? They aren't in school yet, so who refers them
So it
to?
depends on the program. For the Child Sign program, that's kind of one of the earlier programs we get. That's for children at high risk in hospitals, so sometimes we get that upon a prenatal referral or postpartum referral.
Okay,
We also get prenatal and postpartum referrals, so if there's flags, we'll kind of know of those, especially with the neonatal abstinence syndrome, if there's issues there. Because obviously history of substance abuse might affect the growth and development of the child, or there might be some health-related concern that we would get. So a lot of times we get that from the hospital right from the start, or we might get it from a child care provider or concerned parent. Or a doctor.
I was just curious about that. Did we approve that motion? All right, so now we have a motion and a second. All those in favor of approving the annual report? Aye. Opposed? Carried. Thank you.
Next is to request resolution to authorize Jignasia Shah, our Public Health Program Coordinator, to receive reimbursement according to the CSEA union contract for job-related course, which is basic principles and statistical inference. Extra luck on that. And related course expenses upon successful completion of the course of attaining a C and better. This is attachment 12. The course teaches the use of statistics, and it's useful with our agency's community health assessment and improvement plan activities, which we're currently in that process right now. The course is also a requirement for a certificate in public health, which this particular staff member is pursuing.
All right, so would someone like to make the motion to approve that? Supervisor Sokol, seconded by Supervisor McDevitt. All those in favor?
Aye.
Opposed? Carried. Thank you.
Okay, and we have another staff member that we're looking to request a resolution to authorize Laura Monroe, registered professional nurse, to receive reimbursement according to the CSEA union contract for a job-related course, research and evidence-based practice, and related course expenses upon successful completion of the course and attaining a C or better. That's attachment 13. Nursing interventions are based on research and are evidence-based practice. And in addition, Laura's working on her bachelor's, and this is a requirement for that program as well.
All right, would someone like to make that motion to approve that? Supervisor Loeb, seconded by Supervisor Bramer. Any discussion? All right, all those in favor?
Aye.
Opposed? Carried.
Next is a resolution, if you refer to attachment 6, to amend the budget, and funds are still will.
Our first request for transfer of funds is with our WIC program. The grant ends the end of September, and we have some extra funds in the salary and fringe line, so we'd like to move some money out of there and bring it down to the supplies expense till the end of that grant year. Again, fully covered by the grant. And that, the second one is similar. Again, it's our Children's Special Health Care Needs Grant. Again, a little bit extra in the salary and fringe line, and we'd like to get the coordinator of that program a new laptop, which is needed desperately. So, again, fully funded by the grant, and we're trying to move that money. Total both is $4,787. All right, would someone like to make that motion? Supervisor Bramer, seconded by Supervisor Leggett. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
As far as referral and pending items, there are no pending items this month. Jumping to information for discussion and review, I will give it to time for attachments 1 and 2, which is a report of expenditures and revenues in addition to our comparison report.
Attachment 1 is our current financial status as of July 18th, and right now everything is status quo. The salary is as of July 7th when our last payroll was posted for these numbers. To note again, we are 1.42% under last year total when it comes to total salaries, and we are 44.5% of our current budget, and last year at this time in salaries we were 52.81% of the current budget. So we're doing well there. Again, most of that is because of our nursing shortages right now. We're going to try to fill those. On our attachment number 2, which is our comparison of last year to this year, again, the salaries are just noted. Equipment is basically a vehicle that was purchased just recently in April. Contractual expenses, again, are down a little bit there because of the 400. Again, I note that most of it is our preschool program. Again, timing of invoices, and I note here again, which I stated last month, that we have one vendor who is still has to submit rates to the state that are current, and we have, last year at the end of the year, we still didn't have those rates, and we did accrue and hit the books with $35,665, and I got the number for right now, year to date, is $35,808. So as soon as we can't pay those bills until we get an approved rate from the state, so we just hold on to those, and that's what's holding that up a little bit. Employee benefits, again, they're below, again, but the main reason here is the fact that these only reflect up till May, where last year we had up till June, and this year, so as soon as June is posted, then we'll be caught up with that. So that's mainly the reason for that, and I did note too, the retiree health is $102,372, or 372,000, about 14.4% of the employee benefits is retiree health. All right, anyone with questions? Supervisor Lowe.
Thank you, Madam Chair. Sean, in the description, or the discussion area, under notes, you talk about the increase in overtime is due to more time spent on the new Crescendo
Correct.
System, which I'm not quite sure what that is, but then, so that's one question. If you could just a short explanation, of reminding us what that is, and will this overtime then be just part of the regular salaries next year in the budget?
No, we're hoping that, the nurses are becoming more familiar with the Crescendo product. So as far as the overtime, some of that is coming down, but because of the fact, our nurses, we had 2 out on family leave, 1 is still out, so other staff are having to work more frequently, and so that's giving, sometimes we have nurses that decide to maybe take 1 day off or 2 days off, so when they work the weekend, it's not overtime, but we're having less staff that are interested in doing that. And the other thing is, because we have positions that are open, other people are picking up those slots and having, we've had one nurse that was doing full-time of doing nursing orders that have to go out to the state, and she's now taken a per diem. She's still here, but working per diem. She's working like 4 half days. So what we're doing is we have one of our full-time staff that's assisting, but in order to keep our regulations up to date. She's having to take stuff home, and her position is things that we don't, anybody at this table, we don't do orders. That's a special training that they do. So to keep us up with regulations, and because you only have X amount of business days to get the stuff to be submitted to the state, because if it isn't, then they reject the whole payment. So she's having to pick up a lot of orders. So hopefully when we get, more consistent staff, that the plan is for that to go away.
Supervisor Lowe.
Yeah, I was going to say, and the crescendo issue
Yeah.
is still the issue. It's been a year since we've been on the new system, and just to...
And it's our electronic medical record system, because I think you had kind of asked what it was.
And I think
Sorry.
last-
Learning curve right now.
Right, last meeting, we did mention it, and that we had got attorneys involved, and we contacted them, and last week, they did send some reps down to work with us on the problems we're having at no cost, so that was good. We got that ball moving, and hopefully that will start coming down.
Thank you. Thank you.
You're welcome. No question, okay. Thank you.
All right, so any further questions on that?
None.
Alright, so we'll go on to status of referrals. Val and Janelle are here if there's any questions. At our last meeting, you'll remember that Mr. Driscoll suggested a report delineating the different towns that our home visits and our patients are representing. So Janelle created a report, or worked with our vendor to get a report, and we're going to be supplying that twice a year for January to June, and then from June to December, or an annual scenario. So since Janelle did all the work, we'll let Janelle explain the numbers. It's 3A and 3B.
So what I have now begun referencing in the office is the Driscoll report. That is what we are putting at 3B. So I was able to actually go into Crescendo, our electronic medical record system, and pull a patient listing of both active and inactive, because obviously when we're looking from a month-to-month basis, I still want to pull in those inactive patients if they were seen in that month. Even if they were discharged, we still want to count them in that as the visit that was done. So this report on 3B is me cycling through that through every zip code, and they did break it out to, our Adirondack, Bakers Mills, Bolton Landing, Chester. We really hit our entire county, some of which I had to say, oh, there's a place called Adirondack in the Adirondacks, but we were able to figure it out and break it out really nicely, which was wonderful, and it was actually much simpler than I thought it was going to be. So it's something that we'll keep you updated on. Unfortunately, I couldn't do a look back of last year just due to being in the two different systems. There was some overlap, so going forward for next year, we'll be able to compare the data back between two sets of years. It was just when I tried to figure out a way to get our last year's data, it got very, very muddled very quickly, and the numbers just didn't seem to be speaking right.
Thank you. Mr. Driscoll.
I just wanted to thank you all for that, and nice job.
Definitely.
And Val, did you want to go back to 3A?
3A, the status of referrals, it does show that we're a minus 33%, but in clarification with that, it is as compared to last year, not last month. So if you look at the numbers, we actually made more visits in May than we did in April. So, at least when I was looking at it at first, it was like, we're busier than ever, than we had been. What do you mean it's minus 33%? But then looking at from the previous year, not the previous month.
And also attached is the Emergency Response and Preparedness Report, which is on attachment 4. Our rabies report, which is attachment 5. And also for an informational item, please see attached authorization to attend a meeting or convention. This is for me to attend the New York State Association of County Health Official Annual Public Health Leaders Summit in Clayton, New York from August 2nd to 4th. The total cost, including meals and lodging, are covered by NYSHO. The only anticipated expenses is the registration fee of $75, along with gas and tolls. I am looking into a carpooling opportunity, and if that's the case, we'll share depending on the arrangement. As far as staffing, as Val alluded, home care has 2 nurses that are out on extended leave and 2 nurses that are out on intermittent leave that we're working through. So things are busy. and people are covering, and good team efforts being provided by the staff. We did recently hire a nurse that started July 15th, who's currently on orientation. We're actively recruiting nurses. Currently, there's 2 open full-time nursing positions in addition to per diem nursing opportunities. So keep that in mind if you know people that are nurses or graduating from nursing school or have friends or family. We also have an intent to fill form this month. It's a public health liaison. It's a part-time position that's 24 hours. It's a grant-funded position. It's attachment 15. I apologize that all the signatures are not there. I did get civil service and personnel approval, and it got sent up to the administrator's office. I'm not sure quite where it is at this point, but I do try to get the signed sheets usually before I come to the meeting.
All right, but
That's
we do need
attachment
to,
15.
we need to act on that then. We need a motion for that. So if someone would like to make that motion, Supervisor Leggett, seconded by Supervisor Sokol. All those in,
And what does the liaison do?
Works with our emergency response and preparedness program. It's actually a grant-funded position. One of the issues that we had last year was the majority of the year it was vacant, and then at the end of the grant year, we were unable to expend 100% of our grant because that position was looming. We currently have a couple people interested in that position right now, but the position had expired, so we're looking to re-up that. As far as what do, they help update our emergency plans. They work with our community partners. They help organize our volunteers, provide training and updates to them. There's a database that the State Health Department has that this person also helps us maintain with regard to our volunteers.
okay, thank you. All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
And good news that I'd like to report, I'm not sure if Julie came to our meeting, Julie Butler, but she was invited. We wanted to thank her. But with Health Services, we'd like to thank the Board of Supervisors for transferring funding to cover a car that was totaled due to damage sustained in an accident in March from a sheriff's car. We'd also like to express sincere appreciation for the assistance that we receive from other departments and highlight that the efforts and importance of interdepartmental collaboration, which resulted in this case in getting the county a better deal on a new car. Health Services worked hard with purchasing, self-insurance, county attorney's office, and the administrator's office, and with all the due diligence from all the departments, their persistence and teamwork, we were able to get the best deal. So,
Nice to give everybody credit for that. I think that's very nice.
and Julie was instrumental in it.
Okay, great. All right, any committee member have anything they need to bring up? Supervisor Leggett?
Yeah, Madam Chairwoman, I'd like to make mention of the rabies program, the communication to the towns when any event happens. Sarah Arnold always sends something through, so that's really good to see. I think that was a problem a couple of years ago that's been sorted out well.
Anything else? And Janelle, you're all set then? I guess I'll entertain a motion to adjourn. Supervisor McDevitt, seconded by Supervisor Leggett. All those in favor? Aye. Opposed? Carried. Thank you all.
Janelle, quick question. On the rabies report,